Hi everybody, Dr. Kristen here.
And Dr. Dalton as well.
And today we want to talk to you about a common condition that we've been seeing a lot more frequently in our office. So the condition is called Thoracic Outlet Syndrome, and we wanted to share it with you because we have a lot of patients that are coming to us that have been having these symptoms for years at a time. So it's almost they're coming when it's too late. So we kind of want to just preface this conversation so that you have an idea if maybe this is something that you've been dealing with. So why don't you go ahead and tell them what Thoracic Outlet Syndrome is?
What Thoracic Outlet Syndrome is, kind of in a layman's terms, there's some nerves that come out of the neck that run down into the arm that kind of help control muscle strength, grip strength, feeling sensation into the arms and the hands. So what typically happens is in Thoracic Outlet Syndrome is there's some kind of compression or blockage or something in this shorter region that typically we see is more so from compression of those nerves and arteries and veins that shoot down into the arm. So several things can kind of create that compression, such as muscles, really tight muscles, or as well as, you could have a skeletal anomaly. You could have an extra rib that could be putting a little pressure on those structures as well. So, your typical symptoms that you're looking for is numbness and tingling down the arm, especially if you're doing a lot of overhead kind of work. Anything that kind of raises the arms and kind of puts the shoulder in kind of a certain position that can put pressure on those nerves and arteries and veins.
So this is really common we've seen in hairstylists because they're constantly working up here, using their arms above like their shoulders. We see this with people with that poor posture. If you work at a computer and your shoulders are rounded, your neck's forward. We see this a lot if you are a sleeper and you bring that one arm above your head to sleep a lot throughout the night. So we see this in quite a few different scenarios, and like Dr. Dalton was saying, the bundle consists of nerves, arteries, and veins. So there's two different types of Thoracic Outlet Syndrome, and one is vascular and one is nerve. So you can either have a nerve compression to where you're getting that numbness and tingling. Sometimes you can get some grip strength, things like that, or you could have the vascular, which you would still get some of the same symptoms, but you'll also just kind of feel like a heaviness in your arm. Like some of my patients have been describing, it feels like you have a blood pressure cuff on your arm, so you just have a lot of pressure in the hands.
All right, so now that we've kind of discussed what it is, who gets it most commonly, we kind of want to roll into how do we typically treat it, or what's the best way to get it evaluated. So, of course, we're a little biased, but we would love to recommend seeing a chiropractor first, someone that can do a good physical examination on that first visit, that can check out the neck, check out the shoulder, check out the rest of the arm, just to kind of rule in or rule out what really it could be, because there's a plethora of diagnoses that could create this numbness, tingling, heaviness in the arm, things like that. So typically, what we're going to be looking at is how is your strength? We're going to put you in those positions of arms over the top of the head to just see what happens to you when we get you through kind of a movement screen or a movement examination.
So, for example, at home, one of the tests, so this is something that you can do right now, and it will kind of tell you really quick if you have Thoracic Outlet Syndrome. So one of the tests we do is called Ruth. So if you're just standing there, stand with your elbows kind of 90-90 at shoulder height, and all you're going to do is you're going to make a fist and relax, make a fist, relax. So pump those fists for about 3 minutes. And if you do have Thoracic Outlet Syndrome, this will be very hard and you'll get very tired very quickly. And what you'll actually find is your symptoms will increase, but you'll also start to feel your arms drag down. So that's a very good indication that you might be having some thoracic outlet symptoms.
So typically in the office, what you would typically see in a Thoracic Outlet Syndrome patient is your typical chiropractic adjustments. We got to make sure that we're ruling out any kind of cervical neck issues. You're also going to see us kind of do a little soft tissue work. So a lot of times you're going to see those really tight muscles can create that entrapment or that impingement on those nerves or arteries or veins. So we're going to do a lot of hands-on work, a lot of manual soft tissue work. You're going to see some shoulder work as well as down into the arm to make sure that the entrapment's not occurring anywhere else down the kinetic chain. As well as we're going to send you home with some exercises, some stretches to do at home, because not only are you going to be doing work in here, but you're also going to be doing some homework. So that's typically what you're going to be kind of looking at if you come into our office.
So once you come into our office, obviously we do the evaluation, we do the treatment, we give you stretches and exercises, and you should see improvement. If things get worse, then that means the treatment isn't going to work, and we will then send you out for more tests. So then we have worked with many thoracic outlet specialists around the area, and what they'll first do is they'll do an EMG. So they'll check how the nerve is functioning and where it's entrapped. So a lot of times actually this nerve test will come back normal. So that's what kind of strays people away from the actual diagnosis of thoracic outlet syndrome. So you'll have a normal nerve conduction test, but if you do a Doppler test, which is the next step, so the Doppler is going to test the blood flow when your arm is placed in certain positions. So that will really tell, if that circulation is getting trapped, if it's, not getting to the arm once you're raising your arm up. And then typically an MRI, just depending on what is causing your symptoms. Like we said earlier, it could be a plethora of things. Even with thoracic outlet syndrome, it can be coming from, tight scaling muscles right here in the neck. You could have an extra rib that could be putting pressure. You could have tight pec muscles. Like I said, if you're having those rounded shoulders, that can put pressure on that area. So there's lots of different culprits to these symptoms. So it's really about finding out what your culprit is, fixing that, seeing if we can get rid of it, and then basically helping to get rid of your symptoms.
So in closing, according to the research, the typical prognosis or how well does this typically work, 90% of people will respond positively to a multidisciplinary conservative care approach. Now that other 10%, if it is true neurogenic TOS or true vascular TOS, then there always is surgical intervention to give you that relief. But according to the research, 90% people get better with conservative care, which is that's tremendous.
So if you or anyone you know are experiencing any numbness, tingling, pain, heavy feeling in the arms, please feel free to reach out with any questions. Definitely, the quicker that you can go and get evaluated and get treatment, the better. Unfortunately, some of the cases that we've seen in our office, they've just been going on for so long, like years at a time, and they're just not finding the right doctors, they're not getting the right diagnosis. That tends to be more towards that 10% that are gonna have to have surgery because the damage has just been more permanent, really hard to break through to treat. So contact us, reach out to a local chiropractor, and they'd be happy to take care of you. So if you or anybody you know are experiencing any numbness, tingling in the hands, in the arm, feeling of heaviness, your grip strength, you're dropping more things, I would definitely highly recommend getting a proper evaluation or an exam from either a chiropractor or somebody that you trust. So what we have found with some of our patients, unfortunately, is that they have let their symptoms go on for years at a time. Like we're talking a year, 2 years, like to the point where when they finally come into our office, it's almost too far gone to where now we're having to do, going more towards the surgical route. So the quicker that you get evaluated and get examined, honestly, the better your outcomes are. So I would definitely highly recommend reaching out to a local chiropractor, ask us questions. We know people everywhere, so if you need, if you're not local to us, we'd be happy to direct you in the right direction. But yeah, so if you have any questions, please reach out. We'd love to answer them.